Welcome to the inaugural Evidence and Implementation Summit 2023. Behavioural and implementation sciences offer the opportunity to make a difference and create real impact for the healthcare sector for Singapore, Asia and beyond. I look forward to unlocking the transformative power of behavioural and implementation sciences with all of you.
Behavioural and implementation sciences in healthcare starts with a patient-centered approach. It starts from understanding a patient's journey, empowering them through health literacy, shared decision-making, and developing initiatives that ultimately lead to better health outcomes and those patient experiences. There's no better time than now to see how application of behavioural and implementation sciences can strengthen our healthcare interventions to impact at the individual, institutional and systems level.
I tend to celebrate every time we get a successful intervention or an experiment. After hearing all of the different sharings today, that's just the beginning. So I guess the dream now is not to just get a really good experimental result, but to really think about how do I get this to spread within the community and take root.
Many of our projects are not data-driven. I see so many papers coming up to the Ministry of Health with really no data to justify, why the project is important and what are the likely changes going to be given the interventions that you plan to put in place. Because, we don't do all that formative research. We give funding, but many projects fail. And people don't understand why they fail.
What we measure does not always matter. And what matters is not always measured. So how do we share what really matters? When should we do it? And with whom?
I have sometimes experienced that the policy level thinks that something is ready for implementation and has not given any thought to whether the system is ready for taking it up, which to me very much brings this concept of readiness on the radar, the readiness of a system, the readiness of an organization to be a big player for large-scale implementation.
So technology is only as useful as it is actually used and used in the way it's intended. Just because you have a technology that could influence health outcomes and you think it's going to work in a certain way, it doesn't mean that it's going to be culturally accepted.
The members of the community are equally important in the rollout of the research. We know the market because we are the market.
What I did find that when we were transitioning towards scaling, the community and the people that we needed to talk to was actually staff, because they were the ones that were actually implementing. We knew that if we implemented it to a certain fidelity, what the experience from the patients is most likely to be. But we do need to make sure that the staff are equally engaged in order for us to scale sustainably and effectively.
So I think what we would like to recommend is that we need a better understanding of the mechanism of how this strategy, mandate change, or organizational leadership works. For example, would a negative influence, the mandate would result in the feeling of coercion to be involved in the implementation, or positive influence, the mandate would result in a positive belief that the implementation is important and useful.
It's important that partnerships are set up right from the beginning. And scaling doesn't mean doing more of the thing you're doing. It means if you have something that is shown to be effective for the people that you're serving, how do we get that to more of those people?
I think we can help by identifying impactful areas, helping to get input early and pulling folks together, researchers, practitioners, and policymakers. I think we're also happy to play our part moving forward in this whole alliance of folks who are really interested in making impactful changes for the population, for our patients. So collaboration, I think, is really key.
You implement, but still you need people to adopt. And I would also encourage upfront discussion with the ministry, with your other stakeholders to say that, look, what are the data does ACE need to look at? We have to find a way to communicate, engage our patient population and form a group invested perhaps in paying forward and doing this. And I think that's something that we will go ahead and truly try to establish.
We're here to collaborate, to work as partners and to develop team working approaches between clinicians, service providers and academics, and indeed residents and patients. We focus on methods and we really want to develop capacity in the country and beyond. So what we want to do in Singapore is essentially take all of this one step forward.